Coalition for Public Health. This is Terry Hooper, who is
Hi.
also from Carroll County Coalition for Public Health, and she is our Medical Reserve Corps Volunteer Coordinator and Citizens Corps Coordinator. So if you want to become a concerned citizen and get out there when we need help, she's your girl.
So Citizens Corps is a volunteer program, and the Medical Reserve Corps and the CERT, which is Community Emergency Response Team, are both under the Citizens Corps. The Citizens Corps, the training for Medical Reserve is not as extensive to begin with as the CERT. The CERT is a 20-hour training. We're going to do one over the weekend here, either in before Memorial Day or right after. It will be for Wolfboro and Tuftonboro, and we'll do it, as I said, on a long weekend. We've done it over 7 to 10 weeks also. So if you're interested, I also work at Huggins. I'm the volunteer coordinator in all the places.
So if you need a volunteer, call Terry. And this whole program is part of the Anyone Anytime campaign that the state has initiated about a year ago in response to the increase in opiate deaths that we experienced in New Hampshire. And the purpose of this is to get Narcan, which is, Janet will give you all of the gory details about the Narcan, but the purpose of this is so that individuals who are out and encounter someone who is experiencing an overdose have a means to keep that person alive until we can get EMS there to do a full-blown whatever they need. So this is about the 20th? Yes. This is about the 20th community forum that we've done all across the county, from Jackson to Wakefield to Sandwich. And our goal is to do about one a month. So far we seem to be doing 2 or 3 or 4, usually all in the same week. But we're doing our best. But we will go anywhere and to get this word out. So I'm going to turn this over to Janet. Janet is an EMT extraordinaire, works for Huggins, and I'll let you do your credentialing thing and all that.
Okay.
Okay.
So I'm a paramedic. I'm the EMS coordinator at Huggins Hospital, and I'm also a paramedic on a couple of other services. So get to see the different areas, different regions, and be on the different end of things. Opiates have been out for a couple of years. We've been having an issue. Opiates have changed over the past couple of years. It started with heroin, and when our parents used heroin was exactly the drug they said it was. You knew the dose, and people could take a dose, and you didn't hear anywhere near in the news about the overdoses. So in the past couple of years, heroin's not as advertised. It's quite often not actually heroin. It's mixed with fentanyl, which is much stronger than heroin, has a much stronger adverse effect on the patients. And now, if you've heard the news the last probably week or so, carfentanil is the newest addition to it. Carfentanil, what you can put that powder, enough powder to cover a pinhead, will kill you. Fentanyl, it can be the size of a dime, and heroin can be a little bit bigger. So the problem is they all look alike, and what's happening when they're producing it, and China is contributing to the carfentanil problem in here. You have no idea, if you're a drug user, what you're getting. Is it all heroin? Is it all carfentanil? Is there a mix, etc.? We didn't have a way to identify the carfentanil until a couple weeks ago. The lab couldn't test it, so that's why all of a sudden you're hearing that that's what's out there. The biggest concern with all of these opiates, people who are using don't know what they're getting. So, and oftentimes the deaths that we're seeing are people who have not used for months to years, and then all of a sudden start back at the dose they had before. Too much for their body. They also don't know if there's carfentanil in there. And as a business model, I'm not really clear why the dealers are dealing something that's killing people. Go ahead.
A lot of times they only have so much, and then they add things like baking soda, laundry detergent, crap like that in there. And then it screws everybody up with the veins and stuff.
Yeah.
So that's one of the reasons they need to stretch it out to make more money.
Yeah. So the problem with carfentanil, I worked on in Rochester, and we're calling it one and done because it is so strong. By the time they inject it, they're pretty much done. And it takes so much Narcan to revive somebody or resuscitate them, and it has to be immediate, that a lot of times we're not saving the carfentanil overdoses. But this is an effort to try. So what we're doing right now is getting Narcan out into the community, getting Narcan available, training you how to use it, and helping you know when to use it. So just out of curiosity, professional people, I know Adam, any professional people that use healthcare, anything, or just all lay people starting from scratch, because I can abbreviate it if you're not. Okay, so to be really simple, the way the opiates work, and it can be the prescription pills that are crushed, it can be heroin that they've either snorted or injected, it can be the fentanyl, and it can be the carfentanil, but they all go to your brain, and you have a receptor in your brain that when it sees some of those opiates, it grabs a hold of it and it stops you from breathing. So in a nutshell, it, depending on which of those it is and how strong it is, depends on how much Narcan it takes to knock it off. And that Narcan will kind of kick off the opiates, receptor opens, and you start breathing again. So the whole idea of what you're doing is learning to recognize when somebody is down and somebody's unresponsive, and it may be because of an opiate overdose. So the two quickest kind of ways to recognize that, if you know somebody's an opiate user or there's a suspicion to believe they're a drug user, number one, and if you open their eyes, open eyelids, and the pupils are absolutely pinpoint, yours and all of us in here are probably around 2 or 3 millimeters because we've got a light, so they dim down. But when you're with opiates, it's actually a pinpoint for a pupil. So those are all both indicators that would make me suspect if somebody's unresponsive that they've had an opiate overdose. The first couple things, and we don't teach CPR here, but if this person isn't breathing and their heart isn't pumping, they don't have a pulse, you can squirt all the Narcan up the nose you want, but it won't do any good. So while we can't teach CPR, I just encourage you, call 911 first thing you do, because 911, A, will get EMS coming, because if it's something else, and unfortunately right now we're seeing a lot of them combining different medications. We're seeing marijuana laced with fentanyl and all kinds of things, gasoline, you'd be amazed. But that's out there right now. So it could be a bunch of things, so you may be able to fix one thing quickly with this, but there may be other things that you need EMS to help with to fix. So call 911, they will walk you through CPR if you don't know how to do CPR. And the second thing is, if you've got a second person, we're gonna teach you to take the Narcan and just literally put it up their nostril and spray it up their nostril. Okay, so if you need to do that and keep doing CPR, it circulates, and it takes a couple minutes. These people will start waking up. If they don't in a couple minutes and you're pretty sure it's Narcan that you need, it's an opiate overdose, then you go take a second one and do a second one. Okay, that's it in a nutshell. Unfortunately, because of the fentanyl and the carfentanil, what we've realized, the old Narcan boxes that we used to use were only 2 milligrams, and it wasn't enough. We were taking 2 and 3 and 4 of those to wake people up. So the state has put out a new administrator, which is much easier for you guys, but it's 4 milligrams. It's double the dose, because we're finding that that's what it really takes. You can't give them too much in a sense, no harm, no foul. And these are only a 0.5 ml of fluid, so you're not putting a whole lot of fluid up compared to what we used to do. So somebody who's down, who's not breathing, or breathing is really slow, kind of like that gasping agonal breath, and you have a suspicion to think that it's an opiate overdose, then think you're Narcan. What you're going to get tonight after you just demonstrate how to do this and we're all done is this box, and it contains 2 of these in that box. Okay, yep.
What if you mess up something and say they're taking methamphetamine instead of opiates? Will that hurt them if we combine?
It won't hurt them, but if they've been taking meth, they won't be sound asleep, not breathing. Unfortunately, meth tends to make them pretty wild. To be honest, I will take an opiate overdose any day over a meth overdose. That's just the EMS perspective.
So you're not going to hurt them if...
You're not.
Okay.
That's one of the nice things about Narcan, is that even if it's not an opiate overdose, you aren't going to do any damage by doing the...
Because, like you said, some people speedball, which is, take the heroin, take the meth, or the cocaine, or whatever your upper is, and that's like...
And usually we don't find those unresponsive. We usually find those responsive and a little combative. They're not usually happy to see EMS, unfortunately. And we're finding a lot of people are switching over. They're hearing their buddies are dying of heroin and the fentanyl, so they're switching over, and that's why we're seeing a resurgence. A little bit in this area, but a couple towns north and east of here, we're getting hit really hard. And I don't know how hard it is here. I haven't heard as many. But kind of on the other side, there's clearly been a bad batch of something going through because they've been dropping like flies. So no harm, no foul. The big issue that you've been seeing in the news about carfentanil is like, you all know what confectioner's sugar is like, very fine powder, and it kind of puffs up in your face. Carfentanil can do that, it can aerosolize. So if you've got a patient who, especially if they're dealing it and they've got a bunch of it around, or they're cutting it up into their baggies or whatever they do, it can aerosolize, it can get on their clothing. If this person was in their house and I just found them down like this and I just touched them, are you okay, are you okay? It takes a few grains of that carfentanil on their clothing to affect me and make me start to be symptomatic. So what we're teaching, and why I have these gloves here, is we're teaching all EMS and police, and I've just done some very specific training for the police departments, don't touch any patient or anything in a house without some kind of gloves. And you can get them in the grocery store, you can get them lots of places. It's worth it. And if you're here for family members or friends, try to just keep something in your pocket and or don't touch the person any more than you have to. Put a towel down between you, do something, but it's just not safe to touch them anymore.
How about a surgical mask and inhalation?
Well, there's been this big debate for about a week now, and one of the leading docs, EMS medical directors, has said that it's been about 1 in a million. There have only been 3 cases in the country where somebody from inhaling it, third party inhaling it, had any issues. And so they're kind of calling that the 1 in a million case. Would I want to be in a room where somebody's, if there's a ton of it out around there, would I put a mask on? Absolutely. But realistically, what they're finding is people are getting it from touching it. The one exception to that is the canine units. So from the police perspective, they're going in and they've got dogs who are going in and sniffing for it. So we've given training and done everything for all the canine units in this area so that they can be resuscitated as well, because we don't want them to bear the brunt.
So Narcan will resuscitate a dog?
Yes, it will.
How about that?
It is, the one difference is you can give a dog too much and it causes respiratory depression. So I got some instructions from the one of the local vets, and I've given that to all the PD officers, and we've given them the right dosing for their weight of their dog. But yeah, it can. It's pretty sad. They can get it on their paws. It's become a far-reaching problem that we just don't see.
Do you recommend turning somebody over on their side after if you successfully bring somebody back?
So here's the thing. If you resuscitate somebody who's been out cold, think of when you're woken at 2 in the morning from a sound sleep, and you wake up and all of a sudden there's uniforms and there's all kinds of police over you. They get pretty agitated. They don't usually throw up, but they get pretty agitated. So generally what we do is we'll give them the Narcan and step back. Let them do their thing. If you need to keep doing CPR, we do keep doing the CPR, but as soon as they start waking up, step back. Don't try to talk to them. Don't ask them a lot of questions, because they're just kind of coming out of this having no idea their environment they're in. So the less you stimulate for a minute, the less violent they tend to be. They will not always be grateful you've done what you've done.
And you want to first call 911, so.
Yeah, we talked about
Right,
very
and so
first thing.
hopefully
Yeah.
the 911 response is there
Yeah.
before you have to worry about it.
And we're finding lately, a lot of them are awake before our EMS gets there.
So that's good news,
So
it's
that's-
working.
It's working, exactly. But I just caution you, because you've just not only taken away their high, there's a bunch of people around that they don't know. Just be mindful of what it would be like to be in their position, and you won't get hurt. Don't worry about restraining them, not your job. Okay? The one other thing that we do, and the one other reason we want you to call 911, this dose of medication that we give them will last about 20 minutes. The heroin, fentanyl, carfentanil that they've taken can last half an hour, 2 hours. So depending on what they've done and how they've done it. So the big issue is, we'll give them this, we'll wake them up. What are they going to be like in 20 or 30 minutes? Are they going to go right back down? And so we may have to repeat the dose. That's why we encourage them to come into the hospital, and that's why we encourage you to call EMS, because we can give them that second dose. Any
And
questions?
with
Yeah.
there's also the Good Samaritan law.
Which protects.
people who are on premises from being charged with possession of a narcotic under those circumstances if they've called for help. So people need to know that, so they're not abandoning people rather than be afraid of the consequences. Yes.
What about the people that are out? Does that cover them too? The Good Samaritan law?
The people that are out here.
Yeah.
So technically, the Good Samaritan law protects you guys. You're trying to help somebody, you're doing the best you can, and you're working towards your level of training or whatever equipment you have.
So you don't want to empty their pockets?
No, you do not.
Before cops
Yeah.
get there?
No. So if you're not a trained professional, so to speak, wake them up, resuscitate, don't worry about the rest
But
of it.
they can get
Obviously,
charged?
So the person who calls, there is another law, state RSA, that protects the person who called and the person who has overdosed. So
Okay.
the whole reason behind that is we didn't want people afraid to call for
Yeah.
their friends and get charged. So there are no charges. It's a medical, treated as a
Right.
medical issue, and we do that. I wouldn't encourage you to go in people's pockets at all.
No.
Oh, no, I mean,
For
it's
many-
just, I don't
Yeah,
want
for many
people going to
reasons.
jail either, so.
Yeah,
Well, no, you can
you're
get
not
stuck
gonna-
by a needle or something.
You can get stuck by a needle, you have no idea what's in there, they can accuse you of stealing stuff. So that's why, as a layperson, we just teach you, do the medication, get them awake, and when they are, I would just stand back a little bit.
And remember information, how much you gave, when you gave it,
Yeah.
so that when EMS comes, they have all the information that they need to be able to ascertain if something else needs to
Mhm.
happen.
Yeah.
But the other piece is, the reason we're doing this is hopefully when someone experiences something like that, it may trigger a desire to get some help. So we're hoping, I have some information here about the Regional Access Point program that's going on in the state. So if someone calls the hotline, dials 211 or the crisis line for about drugs, they will be assigned to a person who is based in Carroll County who will act as a case manager. I mean, we still don't have a lot of treatment, so they need some hand-holding, but this person will help them find an assessment, get the appropriate treatment recommendations, and help them while they're hopefully not waiting too long to actually get the help that they need. But the goal of this is to save lives. It's not going to solve the opiate problem. We have to do other things for that. But this is really just to keep people alive so that they can get help, because we need all the people we can get in Carroll County.
And no pun intended, but it's a wake-up call for some people. And we've had some that have just been, oh my God. A lot of them won't believe you that they were just dead either. That's pretty common. They just don't, and that's okay. If you don't convince them, that's fine. But it's sometimes an aha moment and, oh my God, what was I thinking? Especially the ones that were off it for a while, tried it, this has happened, they've been resuscitated. Those are the ones I find that are a lot more receptive. So we've got stuff, and we've got stuff for EMS that you can hand out and try to work with them.
What's the protocol at Huggins if Tuftonboro or Wolfboro EMS or police bring somebody into Huggins who's been brought back with a Narcan, who's obviously overdosed? What is the protocol once they're there? Are those people dismissed and once they've proven that they're stable, or is that person assessed by the emergency room doctor and referred to treatment immediately?
So what we can do, they're a medical patient, so they will come in and get a full evaluation by the physician. We will try to get them to stay long enough to monitor and watch them, because again, that Narcan doesn't always last quite as long as the drugs that they may have taken. If they're, and quite often there are other underlying issues, so we will treat and do whatever we can. Once they're awake, alert, and oriented, and what we say is conscious, alert, and oriented, able to understand the mortality of what they just did, the lethality of it, if they want to walk out the door, there's nothing legally we can do to stop them. We cannot have a involuntary evaluation admission. We have to, the hard part and the sad part is sometimes we go through all of the machinations that we do, get them back, they say, I'm fine, let me out of here, and we have to let them walk out the door. So if we can get them to stay long enough, we will talk to them. We have all of the same referrals that are up here. We will see if we can get them in counseling. The hard part for us, There's not a lot of training, there's not a lot of rehab centers, and in this area, there are not. We have gone so far as Nashua and Manchester have the safe stations program, where you can drive somebody and they will take them from there. We have literally had people driven down from here to those safe stations to get them what they need, but they have to want to do that, and it has to be their drive. You can take somebody who doesn't want to do it, and it won't do any good. I've had people that I have literally been breathless, pulseless 3 times in one day and resuscitated, and they still walk out the door. See you bye. So they've got to want to do it, and that's the hard part.
Yeah, when I got sober, like 4 years ago, first place I went was Huggins, and they don't have, they couldn't help me. As far as, they just gave me a script of Klonopins, and that was it. And, but no detox or anything.
Yeah, we're not set
They
up
just-
for it. A
so,
lot of the hospitals are not. Very
In Maine,
few of them are set
you
up for it.
can go to Milestone. In Maine, that was the closest thing I found back then. In Portland, and they have a detox where they'll take you in right off the streets.
They have to be, the hospitals in Carroll County are both what they call critical access hospitals.
Yep.
So there are, I mean, in order to be one of those, or because you're one of those, you're limited in the kinds of things you can actually do. We're looking at trying to get some detox here in Carroll County, but not yet. But I will say in the last couple of years, there are places to go. If someone really wants some help, go over to White Horse Addiction Center in Ossipee. They will do an assessment. If they can't find you the appropriate treatment here, they'll drive somebody to safe stations. I mean,
Yeah.
we are really making some progress, not enough. We have lots of work to do, but it's better than it was a couple of years back when we had nothing. So I'm sorry, I'm glad you managed to navigate the
Yes.
system in the olden days,
went to
because
New
that
York.
shows
I
determination.
went to New York to get sober, but
Yeah.
Yeah.
For the benefit of the videotape, could you explain more detail about the safe stations?
I will try. So the way it is set up in Manchester, they were the first ones that originated it, and it's a safe station that you can drive, or somebody can drive you in, leave you at that station, no questions asked.
A fire
You-
station?
A fire station,
Yes.
yep, sorry. Fire station, you can leave the person there, no questions asked. They will evaluate them. They have somebody right on site who will do a quick evaluation. Then they have a list of places and references, facilities, et cetera. And they will get that patient and navigate that patient to what they need to get for services.
I
It's a
think right
huge.
in Manchester, it's Serenity Place.
Yeah.
And they're doing their best. They're also inundated right now. So,
Right.
but yeah.
So they will do that. Nashua does the same thing. They're just a little bit newer at it, but they're having a great success rate. Rochester has it right now that you can walk into the hospital or the fire station, and they will try and get you an evaluation and get you placed. The problem is, as you can imagine, the sheer numbers. So they're working on it, still getting the system out, but it's a mental health evaluation, and that's done by
Goodwin?
Who's that?
Oh, no,
No, it's not.
Is it Southeastern?
No, it's Northern Human Services and
Southeastern New Hampshire.
another
Service.
mental
no,
health. I can't remember.
it's based in Exeter. It's,
It'll come to us, but anyway, they have the evaluation.
it's a mental health center.
Yeah, and they will come and they will help with the evaluation, but again, the sheer numbers, so it is a little bit of a process, but at least it's a start and it gets somebody occupied.
yeah, I can speak on the Manchester Fire Department too. I was able to get 2 people down there because that was the only I heard of that option. So I got 2 people that wanted to get sober or clean, and I got them down there, and they did. They had a box. They put the drugs in and all that, and but as far as resources, all they did was they called. I think it was a Serenity Place.
Serenity Place.
And then they came and interviewed them and everything, and then they took them, but they took them to a homeless shelter, and really, because for resources,
Yeah,
from my experience, getting sober, it's like you kind of when you're ready, you just got to go straight to detox, and then straight from detox into a 28-day program.
Yeah.
Not from, a fire station to a homeless shelter for 3 days,
They
awaiting
must have
bed
been,
case.
they must have been full
It's
because
a bed issue.
it is a
yeah.
bed issue.
That's what they said. They said if you wait at the homeless shelter for, 3 days, then we can get you in. We could get you an outpatient while you're at the homeless shelter, but you can't get into detox.
Right.
No addict's gonna do that ever. I mean, sad to say,
It's
it's
tough.
just not happening.
That's what we're really trying to work on the state is getting more beds. It is truly a bed availability issue. And it's not just for the addiction, it's also for the psych histories and the psych patients needing treatment. And
There's so
There
many
is-
times that it's a co-occurring,
Yeah.
I mean,
it is.
the substance use disorder is a result of self-medication because of mental illness. And
Right.
so, I mean, we have a long way to go,
Yeah.
but we're making progress. And you're proof positive that people with determination can make it. Good for
Yeah,
you.
congratulations to you, that's
Very good.
huge.
Yeah.
Any other questions about the how, why, when, where? Okay. So
Okay.
no, sorry.
No, go ahead.
So what we're gonna do is just have you demonstrate, just show you, so that I want you to feel comfortable with what it is that you're giving, how to do it. Jennifer's got a quick sheet of paper, just put a little information, you can all remain anonymous, but it gives you the medication and you're good to go out.
Good to go.
And-
There's, yeah, I think we should cut the film now.
So,
You're on.
Go ahead. You're gonna come up to your patient, you find somebody who's not, doesn't appear to be awake, doesn't appear to be breathing. You can check for a pulse if you know how to check for a pulse. If you don't and they just don't look like they're doing well, you can stick this in the nose, push this, whoops, so you can see it. Push that in, fluid is in. I'm gonna watch him and see if he starts to wake up at all. If he still did not have a pulse, again, I would have 911 on the phone. So if they directed me to keep doing CPR, I would keep doing CPR. And when he starts to take a gasp and starts to wake up, I'm stepping back out of the way and letting him wake up without issue.
CPR again is how many pumps and then breath?
So, again, just liability-wise and what the state wants us to teach, I can't teach you CPR. What I can say is when you've got 911, they tell you to put the phone down on the table or the floor next to you and put it on speaker, and they will walk you through it. The general theory on CPR right now for the layperson is just continuous compressions. And if you're about my generation, you remember the song Staying Alive? That's about the right beat. So you're doing this, and this tape is not the easiest, but
Somebody has to sing now.
yeah, and you're doing this at a rate of about 100 to 120 a minute. And so this is about the rate that you're just gonna keep doing. And you wanna push hard enough that you're going in 2 inches. I might collapse
So
this
there's no
table.
mouth to mouth with this?
You don't have to do mouth to mouth, and I would not, and I've been doing this for 35 years, and I still would not do mouth to mouth.
Okay.
How much fluid is in the bottle? And
This
when
is
you-
a half an ml, half a milliliter, so this is
So
the
what when you press it in, you emit
One
all
whole
of it?
thing. The
the
whole
whole
thing
thing,
will
okay.
come out, and it's a few drops, it's not even a teaspoon.
All right.
Could you talk about, please, the proper storage, the temperatures,
So this is
temperature
a-
range,
this
and
is a
how
med-
do we keep this? Like, I got trained initially thinking, oh, cool, I'm gonna keep this in the glove
Car.
compartment of my car.
Right.
And that ain't gonna happen.
It doesn't work. So this is a medication, and like all medications, it has a temperature range that it works best in, and to keep this medication effective. This one is 59 degrees to 77 degrees, which is a fairly narrow temperature range. So what we've been trying to do is talk to people. You've got an hour or two if you're leaving it in the car and it's still in the box, but don't get in the habit of it. If you've got a refrigerator, the insulated lunch bags, I don't know if anybody has one, and you want to carry it around in that, you can do that. You can't leave it in your car. I've had a lot of women say they just carry it in their purse because that kind of goes everywhere they go. Doesn't get hot or cold. It's got to be in the house at night. And that's been one of the challenges for our local law enforcement, is for them to be able to find a way to keep it within the temperature range. I will tell you that if this hits 85 degrees and I've got a patient down, am I going to use it? Absolutely. It doesn't mean that at 85 degrees it doesn't work at all. It just means that so-called efficacy is less than the 100%.
Okay.
Okay.
Where else can people get Narcan if they're not at our training?
They can get it at Rite Aid Pharmacy, CVS Pharmacy, Walgreens Pharmacy, all have standing orders, so there's no prescription necessary. There will be a charge, but most insurance will cover it. And prices vary, it's worth making a phone call. The other places in Carroll County that you can get it for no cost to you are the emergency room at Memorial Hospital in Conway, White Mountain Community Health Center in Conway, and the Tamworth Community Nurses have a supply. You need to call the Tamworth Community Nurses ahead of time because they're often out, just to let them know that somebody's coming. But those places in Carroll County have state-provided naloxone available for the individual. So those are the places. You also probably should know that all of our schools now have Narcan for their crisis teams and for their nurses, obviously, but others and that's every school in the county now has Narcan.
I just have a quick question. Is there like a weight limit? Like, for instance, suppose a 4-year-old gets into someone's stash on accident, and, is that like gotta work the same as an adult, or is it gotta overdose the kid if we give it to him?
So you're not going to overdose the child, but I would strongly encourage you before you do anything. If the child gets into something called poison control, they're your number one reference for that. You can do the Narcan, but really call poison control and call EMS, because with kids there are a lot of other issues. And this is not a weight-based medication, which is what I think you're asking.
Yeah.
Yeah, it's not a weight-based medication.
Because I've seen like 400-pound dudes pass out. I'm like, okay, how am I gonna move that and get it out of my doorway?
So it's, if you think again of the receptors in the brain, literally all that medication does is clear off those receptors in the brain. It's Narcan is to an opiate overdose like insulin or sugar is to a diabetic.
Okay.
Okay, different receptors, but the concept is the same. So it doesn't matter how much you weigh, you actually have X amount of receptors in the brain, and so that's what you're trying to get the medication off of and change what's on there. Good question.
How long do these boxes last? What's the expiration?
May of 2018.
Okay.
Amazing.
They've just
Issued.
issued. They had to take some back because they had expired from the first batch, but we're now in the process of getting those replaced.
Janet, are those units stronger than what was initially put out as far as like the PD carries and stuff like that?
The concentration on these is 4 milligrams in a half an ml.
But as far as container-wise,
Yeah, it's twice as much.
Yeah, it's 4 milligrams in a half an ml, and that's it total.
no. As far as the container itself, the units, they're having problems with them breaking.
With the Lurgex that we issue? Really? Okay. Because the concentration, there was only 2 milligrams, and that was in 2 mLs, which was a little bit of a challenge sometimes.
Good to know.
So are we done filming?
It's up to you.
Yeah.
Yes, we are.